Welcome to today's press conference. With us today are Dr. Chuang Shuk Kwan, Head of Communicable Disease Branch CHP, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chuang, we have 1,832 PCR test positive cases, 1,877 cases of RT positive. Altogether, 3,706 cases of COVID positive cases since the fifth wave. We have 1.15 million positive cases, 729,300 PCR tests, and also 429,000 AT positive. Of the PRC positive cases, we have 293 from the HA, 250 from the public health lab of the DH, 1,289 from the private sector labs. In the PH lab, 1,000 of the 1,237 cases, we have conducted genome sequencing. L452R, the number was none. 1,225 tested L552R negative, that's Omicron, and 12 are indeterminate because of the low viral load. We had 10 imported positive cases, 6 arrived on the 2nd of April. KE 607 from Korea, TP 600 from France, QRA18 from Switzerland, SQ894 from Singapore, EK384 from Thailand, and there are 4 who arrived in Hong Kong earlier, 2 from cabin crew members. From the care homes, there are no new outbreaks or no new cases, but for homes where there are residents who tested positive, there are 103 residents and 43 staff members reported from 61 care homes. Also, from the HA, they submitted, or today they submitted 111 death cases tested positive. Altogether, 7,906 deaths were reported from the HA, the fifth wave. 53 were reported from outside the hospital authority. The total number stands at 7,959, of which 3,238 females, 4,721 males. The age range between 11 months and 112, the median age 86, 8 below the age of 18, and well over 96% are over the age of 65. 55% are residents of care homes, and the fatality rate is 0.69%. We mentioned the unvaccinated cases, and it is 3.19, 1 dose, and 0.94, 2 doses, 0.14, 3 shots, 0.03%. And also the CHP has updated the RAT sampling methods. You might wish to browse the web for that. And prior to sampling, one should blow the nose with a tissue a little bit so that the discharge would come down a little bit before sampling is taking place. For details, you might wish to browse the web for the details. Dr. Ho, there are 10,009 COVID patients who are in various hospitals, in North Lantau Hospital Infection Control Center, HA Infectious Disease Center, and AWE Community Treatment Facility for treatment. There are 9 cases in critical conditions, 17 in serious conditions. 78 of the 78 critical patients are in the ICUs. As of 00 hours, over the past 24 hours, there are 96 patients who tested positive, who have passed away, 49 males, 47 females, ranging in age between 43 and 109. And for the patients who passed away yesterday, 51 came from the care homes, 59 unvaccinated, 28 with 1 shot of vaccines, 8 with 2 shots, and 1 with 3 shots. 90 above the age of 65. There are a number of younger diseased patients that I'd like to highlight for your attention. 43-year-old male, 50-year-old female, 58-year-old female, and the fourth one is 50-year-old female. All of them were cancer patients, or they had immunocompromised conditions. Because of the time lag, we are submitting today between March 1st and 11th. There are 15 patients who have not been reported, 12 male, 3 females, ranging in age between 38 and 99. One is a younger patient, 33-year-old or 38-year-old female. This female patient had coronary heart conditions, and she also had thyroid conditions, and she passed out at home. The ambulanceman turned up, and she had to be given resuscitation by CPR. At the A&E, she was resuscitated, but sadly she passed away, and the case would be sent to the coroner's court for follow-up. Over the past day, 871 patients have recovered and been discharged. There are 5 patients who were picked up upon screening, admission screening. 7 patients are listed as close contacts. For staff members, 21,239 have been infected. 19,094 are back to work so far.
The floor is now open to question. Please put up your hand if you wish to put questions. Before putting your questions, please tell us your media outlet. First, there's a journalist over there. I'm from Now TV. First question. Previously, several hospitals, Haven of Hope, Nedasol Hospital, and Ruttenji Hospital, there was talk that it would be converted into COVID hospitals. When would they be converted to become such hospitals? And yesterday, there was an announcement that private doctors would be given COVID antivirals. So what would be the procedure like if a patient approaches to the private doctor for the antivirals? And this morning, it said that there is an underutilization of some clinics. So does it mean, what will you do? For the hospital authority, we announced that several hospitals would become designated COVID hospitals, including Queen Elizabeth Hospital, North Lantau Hospital, Tin Shui Wai Hospital, and the Feng Yu King Hospital. All the hospital beds at these hospitals would be made available for COVID patients. Half of the beds in A&E departments and general wards have been set aside for COVID patients. For some hospitals, like the ones you mentioned, would have designated floors to receive COVID patients. These hospitals are Ruttenji Hospital, Type Alice Homeland Medical Hospital, and Haven of Hope Hospital. Overall, whether it's a designated hospital or not, most public hospitals are receiving COVID patients as long as there's a need. We will arrange for a hospital to admit the patient. The hospitals will make the arrangement in accordance with the COVID infection control protocol. As for the antiviral drugs, as at the 2nd of April, the hospital authority has provided more than 23,000 courses of the two antiviral drugs to patients. At this moment, the HA at public hospitals, community treatment facilities, designated clinics, and elderly care homes and holding centers, we have prescribed these two oral antiviral drugs. At the HA Patient Support Call Center, the staff has proactively reached out to patients in need. For high-risk patients, we prescribe the oral antiviral drugs. To provide support to more high-risk COVID patients, the HA has provided the two antiviral drugs to private hospitals and holding centers. Through different means, the HA will also provide simple and clear information on the oral COVID drugs to help the doctors prescribe the drugs to patients. We agree that private doctors should prioritize high-risk patients and provide them with treatment, including those aged over 60 or those aged 5 or below, pregnant women at 28 weeks or above, and those immunocompromised, such as those who have had organ transplant or those who have had conditions leading to a weaker immune system, and those taking medicine that leads to a suppressed immune system. The private doctors cannot charge these patients for the COVID drug. The government is enhancing the relevant computer system, including the electronic health record sharing system, so that private doctors, in prescribing the oral antiviral drugs, can register the details of the relevant patients. In due course, the government will send letters to the private doctors regarding the arrangements for making these drugs available. Turning to the designated COVID clinics, the utilization rate is around 50% at these designated clinics. We want to make an appeal here for those with symptoms. If they are over the age of 60, whether they have been vaccinated or not, and for those who have underlying conditions, if they test positive after an RT test or other tests, go to a designated clinic, and we will arrange medication for these patients. Next question. The last row, the lady in white. I'm from Mingpao. A question about the numbers. Just then, Dr. Chuang just mentioned something. We had 3,706 cases. But then, when I add up the PCR positive cases and the RT positive cases, I get a different figure, 3,009 or so. Can you clarify that? There's this case you mentioned. This patient has been triple jabbed. Can you give us more details? Does this person have underlying illnesses? There's also this case, a 38-year-old female whose death wasn't announced earlier. When did this patient pass away? Over the past 2 days, have we seen any new variants among the imported cases, such as the XD, XE, or XF variants? This morning, Dr. Tony Ko said that there are roughly 150 patients put on ventilators. Are they mostly the elderly? Do we have younger patients who are also on ventilators? What's their condition like? For the figure today, it's 3,709 cases. 1,832 PCR positive and 1,877 RAT positive cases. For the imported cases picked up at the airport, we do some basic genetic sequencing for those cases, and we also do swab checks for whole genome sequencing. If there are anything out of the ordinary, we will make an announcement. Some details about the patients who passed away. It's a patient whose death wasn't announced earlier, a 38-year-old female at Kwok Hospital. This lady had 2 jabs of the COVID vaccine. The second dose was received on December the 30th last year. She had a coronary heart condition. She also had a thyroid condition. At the A&E department, when she was taken to the A&E department, it was the March 1st at noon. Her family found that she passed away at home. She passed out at home. And the ambulance officers, upon arrival, tried to resuscitate her. And then she was taken to the A&E department. We continued to perform cardiopulmonary resuscitation or CPR on her, but sadly she passed away. Her case has been referred to the coroner for follow-up. And there's a second case, this patient who was triple jabbed. It's also a case whose death wasn't announced in the past. It's a 56-year-old male. He had a tumor in his brain. There's also something in his throat. He also had underlying conditions. Or rather, he was also movement issues. We found serious intracranial hemorrhage. Upon testing, we found he tested positive to COVID. This case will also be referred to the expert panel for follow-up. But given this hemorrhage in his brain, his death may have more to do with the brain hemorrhage. You also mentioned something about the ventilators, the overall usage of ventilators. Now, I cannot go into the specifics of each case, but for ventilators in general, they are for those with breathing difficulties. Apart from the elderly, for those with heart or lung conditions, they may require assistance. But we don't have any further breakdown in terms of those who require ventilators.
Lady in red over there, please. TVB. Over the past couple of days, we have triple-digit fatalities. The positive cases have come down, but the fatalities remain pretty high. Why is it the case? Is there anything that can be done to reduce the fatality rate as well, please? First of all, the fatality rate, the number seems to be lagging a little bit behind after testing positive, but this is also pointing a downward trend. If you look at different phases, internationally, it's been found to be effective. It is the vaccination, inoculation. Inoculation can drive down the severe cases and also fatality. And that's by way of prevention. If someone has to be misfortune of getting infected, we do have a wide variety of ways for the patients to receive information and to undergo treatment. Now, by way of information, as we said, we have the PSCC, the Patient Support Call Center. We have nurses calling you, and if people are puzzled, they can call up and ask. And we also have the designated clinics, whether someone is a high-risk patient, if someone is infected, if someone feels unwell, they can turn up at the designated clinic for treatment. So by various means, whether it be a telephone call or HA Go, people can make advance bookings. If people don't know how to operate the system, when they turn up, we do make a special arrangement. We do have the priority tickets for the high-risk people. If you walk in, we still would look after their needs. So people should seek medical attention as soon as possible if there is any deterioration, like shortness of breath, fever, chest pain, and so on. The A&E departments will also look after these patients. So at different stages, if people do need the care and attention, we do provide a service. And for hospitalization, other than the designated COVID hospital, we have half of the beds that have been converted to COVID purposes. For those who are in stable condition, we understand that we do have the community treatment facilities that are available for the stable patients to go to. All these would certainly help. But I hope that all these various measures, of course, we have the TCM team, we have the medics coming out to help out from the mainland. So our capacity has been ramped up tremendously. I'm sure that in terms of the 3 reductions, we are able to achieve the target, and that's reduce deaths, critical cases, and infection. Next, please. Gentleman over here, please. RTHK. The government said that during the C election, there is an exemption for the group gathering, and we have seen a reduction in the number of cases to a few thousand. How do you assess the impact of these activities on public health? Now, there is a saying that if we see more activities, the cases are likely to rebound. Do you think that this relaxation would be running counter to the principle? On Thursday, the consumption voucher scheme will be released. Do you anticipate more people being out and about? And these would have implications on the COVID situation. There is likely to be a rebound. And also, HA urged the COVID patients who have minor symptoms not to turn up at the A&E ward. Now, it was said this morning that the A&E is under less pressure. Now, if people turn up at the A&E and they can be admitted to the hospital if after assessment, so what sort of patients should be advised to turn up at the A&E departments? And in terms of the antiviral pills, what is the stock at the moment, and how much will be reserved for the private practitioners? And which of the 2 oral antivirals are more commonly used? Right, if I may take the question first. I understand that the CMAB has already issued a press release in connection with the fact that if the CS is satisfied that certain group gathering is justified, the power would be invoked. So I hope you will have a look at the press release for all the details. And there are always these exceptional circumstances that would warrant exemption. It's all a matter of a balancing act in this regard. We can see that the pandemic has eased a little bit compared with earlier times. We have opened up more facilities like the designated hospitals. So the pressure on the A&E department has been eased. So at the designated clinics, we do have some quota available. So we're urging the patients who have minor symptoms to turn up for medical attention if they feel unwell. We understand that the government earlier did issue the oximeter to the public, and they also dished out the thermometers. If people suffer from chest pain or shortness of breath, and if they feel that they're suffering from seizure or cramps, if children are suffering from loss of appetite and vomiting and so on, they can turn up at the A&E department. Now, for the antiviral pills, we have distributed a lot of them, and for patients who are in need, we are able to prescribe these to them. So people should seek medical attention if they feel unwell. English question, please.
Good afternoon from SCMP News. A few English questions. Regarding the death figures, now that we are seeing lower death figures gradually, is there a timeline on how long more the authorities will take to clear or finish announcing the remaining backlog of deaths? How long more will the lag of the deaths last? My second question is on what are HA's current COVID policies related to pregnant mothers, especially with regards to birth partners being allowed with their wives again? Will there be a policy change soon with a vaccine pass now in effect? And what happens to a baby at birth if a parent tests positive? Will both be sent to isolation? Thank you.
So for the death case, we are still updating the data. So that's why you see there is some delay, and we will do it as soon as possible. For the husband accompanying labor, and we know that the importance for the husband to accompany the pregnant lady to delivery. But as you see, the fifth wave is still pandemic and severe. Although the numbers have been down from decided from 5 digits to 4 digits, but in fact the number is still very high. We will regularly review the policy, and if the situation improved, we will adjust the criteria so that the husband can accompany the pregnant lady.
The gentleman at the back. I'm from AM730. There are infected cases everywhere, and many buildings have been on the list of buildings where COVID patients have been to. But then there are courier workers who still have to deliver goods to these places. Is there any meaning? Is it still meaningful to have the relevant courier delivery policies? If you keep seeing buildings added to the list, would that make things inconvenient for delivery courier workers? You just mentioned that Rutherglen Hospital, Alice Home International Hospital, and the Haven of Hope Hospital would set aside some floors for COVID patients. Announcements were made in the past. When will these hospitals start setting aside the floor? And what percentage will that make up for these hospitals? And if you said it isn't too meaningful whether a hospital is designated a COVID hospital, then why we're doing this? Just then, the HAU mentioned that the real-time reproduction rate, or RT, has been climbing up, but we're seeing infections dropping. Does it mean that an RT below 1 will mean infections will keep dropping? Regarding the death cases, you mentioned that 56-year-old male was one of the cases from the backlog cases. But can we have more details about the patient, the triple-jabbed patient who passed away? About the building list. We update the list every day. Some buildings get taken off the list after 14 days, and if you keep seeing the same building up there, that might mean there are more infections in the same building. We maintain the list of buildings for the sake of transparency. As for courier companies, they may have their own corporate policies, and I'm not in a position to comment on that. Now, the reproduction rate. At the peak, the R was 1, but now the R is below 1. That means infections are dropping. The death cases, some are relatively younger, a few are unvaccinated. Just then, I mentioned this triple jabbed patient. I don't have details at hand about this patient. For the hospitals, more than 9,000 COVID patients are staying at various public hospitals. Whether it's a designated COVID hospitals, different public hospitals have received COVID patients. Some hospitals have set aside an entire floor for COVID patients. That may make it easier to arrange the beds, and we have the flexibility. But for AIR rooms and the usage, that may be less flexible than having an entire floor dedicated to COVID patients. But we will keep reviewing the situation. The next question, the journalist at the front. I'm from News. The government has been appealing to the public to do RAT tests from April 8th through the 10th. But some experts said they're concerned about the accuracy, and some people may not report their results, and that may affect the effectiveness of the exercise. Have the authorities considered what to do given these problems and any possible ways to enhance the exercise? Any thoughts on this? Second question, if you identify a lot of COVID patients after the 3-day exercise, have all the support measures been in place to cope with a possible surge in COVID patients regarding, say, hospitalization and contact tracing? A third question, for the Kaita Cruise Terminal Holding Center, which is in use, there is an integrated approach with Chinese and Western medicine collaboration there. But for the Chinese medicine practitioners working there, there have been difficulties regarding the registration and bringing in Chinese medicine. Any solutions from the authorities? And what can be done to further improve the collaboration of Chinese and Western medicine practitioners? Regarding the accuracy of rapid antigen tests, I think we get a rough idea of what it is. The point about getting everyone to do RT tests every day from April 8th to 10th is to get a sense of the infection level in the community. If everyone does it properly, then we can get accurate results. The CHP has updated the guideline on how to do a RT test. Professor Yun Kwok-yung has also made this video showing everyone how to do a test with the RT. You can check this out. We're still seeing cases, and these cases are being handled. So we're not too worried about bottleneck. About the use of traditional Chinese medicine, or TCM. For the proprietary Chinese medicine, like the Lianhua Qingwen capsule, Jinhua Qinggan pills, and the Huoxiang Zhengqi tablets, these proprietary Chinese medicine has been distributed at different facilities. More than 120,000 packs of these proprietary Chinese medicine have been distributed. But people should consider their condition before taking the medicine, and different people may respond differently to the same drugs, so they should consult a Chinese medicine practitioner before taking the drugs, and they should also refer to the label on their packs. Next question, the lady in the jacket. I'm from Cable. Mr. Tong Xiaolin, recommend that traditional Chinese medicine should be incorporated into our public healthcare system. And now the hospital authority is dealing with a large number of COVID patients, meaning the staff are under heavy load. If we make changes to the system, will that lead to chaos? Is it a good time to revise our system in distributing the oral antiviral drugs? Should there be a record and a way to make sure the private doctors don't charge the patients for the drugs? Now, on April 7th, the consumption vouchers will be handed out. Are you worried there will be more people out and about, leading to a rebound in cases? Now we are seeing 4-digit infections every day. Is it a good time to be handing out the consumption vouchers? Do you see a need to delay the handing out of the consumption vouchers? I'll take the question about the consumption voucher. I'm aware that there's a long period of time in which people can use the consumption vouchers, so people don't have to hurry to use the vouchers. So hopefully not many people will be out and about because of that. The Chinese medicine experts exchanged views with us and gave us a lot of advice. We will look into their recommendations and look into ways to incorporate those advice into our system. Next question, the reporter in checkered jacket. I'm from HK01. Just then we talked about this universal RAT exercise from April 8th to 10th, but this is not a compulsory exercise. Are you worried that you just end up with a similar number of people reporting their infections as the current RAT platform of the CHP? That if people in a situation where there are like positive cases, should they submit their positive test result again? The chief executive has made it clear that the RAT test exercise is a voluntary exercise. We hope people will take part in the exercise so that we get a sense of the silent transmission in the community. We didn't have RAT kits in every household in the past. Some people did not buy such kits in the past. But now there's this opportunity for everyone to do an RAT for recovered COVID patients. For recovered patients, they will not be testing positive because after they recovered. But if it has been a while for people, since people get affected and they have symptoms, they should report the symptoms. We'll take the last question.
Phoenix TV, Dr. Chuang. About the positive cases, the number has been coming down. The number has been hovering at a pretty steady level. Now, there are many places where there are positive cases from the sewage surveillance. How to assess the current situation and how to anticipate the trend? Well, the trend is coming down, but we still are having a few thousand cases. So in the community, we do have some chains of transmission. We hope that the trend will continue to go down. Thank you all very much.